This is Steve Zeltzer with Workweek Pacifica, and we've been covering the struggle in National Nurses Union, their fight around healthcare, but also fight around democracy in the union, particularly most recently the Alta Bates struggle in the East Bay. And today we're going to be talking with some members of a group that are in the National Nurses Union called Shift Change, who they are, what their issues and concerns are, and what they want to see in the future. So welcome to our show.
Thank you.
Thank you. My name is Jehad Adwan. I'm a nurse in Minneapolis. I work in a pediatric hospital run by the Fairview system. And I'm also a nursing faculty at Minnesota State University. So I belong to two unions. What we're here for is the National Nurses United and the Shift Change Slate. And I joined here because there are lots of issues that our local union has, the local nurses, they have a lot of concerns, and we'd love to discuss those with you and give everybody a chance to introduce themselves and get the conversation going.
Thanks, Jehad. My name is Rosita Villarroel. I am a nurse here in California, in the Bay. So I work at UCSF San Francisco. I've been there for about 12 years. I've been with NNU CNA for about that time. And I am a chief nurse rep for the Mission Bay campus. And thanks for having me.
And my name is John Hieronymus. I am a registered nurse at University of Chicago Medical Center. I work in the PACU. I've worked in medical ICU, emergency room, and hospice. I am a rank and file agitator and organizer at University of Chicago and with other nurses in the Chicagoland area who are active in National Nurses United and our local, California Nurses Association National Nurse Organizing Committee. And you mentioned Alta Bates. Alta Bates struggle was where we connected with the first time where nurses from Chicago were able to connect with nurses in California around, in particular, issues that concerns we had with how our union was being run. So I just thank you so much for giving us a little bit of your time and sharing our story with your audience.
And my name is Xenia Green, and I am a nurse in the ER in the Bronx. I've been in the emergency room for the better part of 3 years. I transferred down there, shockingly, after COVID, when most people were running away from the ER as nurses. And prior to that, I was in the ICU. And I'm so glad that you're taking the time to give us a platform to discuss the positive changes that we want to make in our unions across the country. And can't wait to get started.
Great. This situation, or the crisis in healthcare and the problems that nurses face, healthcare workers face, the COVID has been disastrous, the loss of lives, the loss of patients, and also the crisis in the healthcare system. What is facing healthcare workers and nurses, and why is this particular time important for the union and for what the issues are that are faced by nurses, National Nurses Union?
We were joking about this before we got on the call, where we were talking with each other about, anytime anyone is calling you a hero, get ready for some really unpleasant things to come down the way towards you. When we're talking about the crisis in our healthcare system and the crisis in nursing, oftentimes we kind of frame it as it's not a nursing crisis, it's a staffing crisis. During the pandemic, there was a concerted effort by the people who own our hospital system to try and fundamentally change the nature of nursing in the United States, to casualize or try to create almost like a gig economy inside of nursing, where they were offering an extraordinary amount of money to nurses to become travel nurses, because we saw during the pandemic many nurses exited nursing, which is not an uncommon thing. Up until the pandemic, it wasn't uncommon for 30% of nurses to leave the bedside within the first 3 years of being a nurse. And that kind of is indicative of the overall chronic understaffing of our hospitals. We know that from research and experience with California that nurses leave the bedside because they feel burned out, they feel something called moral distress, they feel exhausted and kind of underappreciated and underpaid. And we're also victims of patient violence and kind of like a systemic violence that we see every day at work when patient care is kind of denied to our patients by management making staffing decisions. That was all exacerbated during the pandemic, and when you start seeing nurses able to pull in 100, 150, 200, $250 an hour to kind of fill the vacancies that were all of a sudden opening up, and the healthcare system is using this flush with money that's being pumped into it by the federal government. It was an opportunity. We literally have heard from nurses, travel nurses, coming in to work exclusively in unionized hospitals where nurses had the most organization, most power, and we've seen how that has made nursing weaker. We've seen how many nurses who had a lot of experience exit the profession, and it's making healthcare weaker because everybody understands at a fundamental level that without nurses, there is no healthcare.
If I just may add one thing, in Minnesota, we went on strike in the fall of 2022, and that was to negotiate a new contract, and the hospitals were complaining that we don't have money for, giving you a raise, we don't have money for better PPE and staffing, et cetera, all these core issues that nurses cared about so much. And yet, when the strike took place, the lavish amount of money they spent on travel nurses while we were picketing outside, the stories that were coming out of inside the hospital, managers being there all the time and supporting the nurses who are coming from outside. John talked about the pay and obscene amount of money. Those are brought in and accommodation and everything. All of a sudden, they had money. I don't know where that came from, but when it comes to their, the most faithful, most committed nurses that they started losing, during the pandemic and right after, it just doesn't make sense. And unions need to be stronger and more representative of those nurses, rank and file, or who are the foot soldiers, if you will, the heroes. Because, like John said, once you are being called a hero, something bad is going to happen to you. So you're being the sacrificial lamb, if you will. And nurses are usually the first people to go and sacrifice, but the last people to be on the list to be compensated properly. Very simple thing. All the millions, maybe billions of dollars spent during COVID, frontline workers, compensation, everybody was so excited about. We got like $400 for all the suffering and that's like working half a shift or a shift at the hospital. So it was just a joke, and we could do better than that. We are going to do better than that.
And I know at UC, they had protests over the fact they didn't have PPE. For years, they haven't had PPE, so it's and they don't stock it up because it costs money. And nurses and healthcare workers are the ones that suffer as well as the patients when they get COVID and the deaths that result in the sickness. I mean, what a nightmare, having to go to work and not having proper PPE in a hospital.
I was just going to add on to that, how does shift change kind of work into that whole kind of puzzle of what we're talking about? And it's really listening to what the nurses need at the time. And, that even comes into our own union. There's often times where we're the bedside nurses, we're talking, we're asking, even before COVID, we're asking for better staffing considerations. And even though we have ratios here in California, we're still having staffing issues. There's still units that are not staffed appropriately. But aside from that, it's also, the very small things of what nurses are fighting for, the rank and file in the units. You said PPE. Yeah, that was something we knew about well before COVID, that they weren't prepared. but it's also moving contract issues along. And one of the biggest things that we have seen is, there's kind of this standard of, a slow mill of how grievances and arbitrations are moved along. A nurse has a contract issue that is violated, and it's our job to enforce it. But it's also the union and CNA and NNU's job to actually keep that grievance going and moving in a way that resolves it. And arbitration is one of those. And once you file a grievance, it should go through several steps. And if it doesn't get resolved within a certain step, then the arbitration process. But we're seeing that happen, 2 years down the line. So, it frustrates nurses. So we want to be able to have that voice a little bit more firm with how we move things along, especially for our needs.
This is Xenia. I just want to add to what everyone else has mentioned is just like anything else, people need to feel fulfilled when they go into work, especially a nurse. And so if you want to keep nurses in the profession, then you have to recruit them. You have to then, once you recruit them, bring them into an environment that is healthy, a healthy work environment, and allow them the opportunity and the time to grow. And I think that us, the four of us in this group that are running together are really focused on recruiting the new nurse and having her be placed in a situation or in a hospital facility or clinic where she actually feels respected, heard, empowered to advocate for her patient in front of her and for the community at large. And so I think that's one of the biggest focus that I have is as part of this group is to make sure that the environment that the nurse is coming into is an environment that she wants to stay in, because otherwise it will be just a bottomless pit of folks coming in, folks coming out, folks coming in, folks coming out. If they come into a toxic environment that's unhealthy for them mentally, morally, they're not going to stay. And so it doesn't make any sense. And so as a union, we have the ability to fight back the boss and say, absolutely not. We're not going to take the 7th and 8th or 9th patient because it's unsafe. And then I don't feel like I'm doing a good job. I know that I am not doing the job that I can do because I don't have the tools to do it. I am literally one person and I cannot manage 9 really sick people. And that's, one of the hugest problems I feel like in the US and maybe across the world is we don't focus on preventative care. We don't focus on having enough primary care physicians. There's not enough nurse practitioners in the community. There's not enough pediatricians in the community. Like we need to focus on preventing the illness before it escalates to the point where they have to come into a hospital. And we have to make, healthcare affordable so that people can not only get in touch with a provider without having to wait 3 to 6 months, but also be able to take the time off of work to go to the doctor preventatively. And so I think it's, it's multiple issues that intertwine with each other. And as a union, we have the ability to listen to the nurse at the bedside that's actually taking care of the patient and go, okay, this is an issue that you notice in your department. How are we going to tackle it? We are a union, and the right of being in a union means that we can fight back big business, big pharma, big hospital administrators without fear of retaliation.
The monopolization of healthcare in the United States. I know in San Francisco, UC doesn't have money for their staff, but apparently they have money to buy more hospitals. I think the monopolization of medical care with these big HMOs around the country, how has that affected nurses and healthcare workers, but particularly nurses with these monopoly corporations that nurses are dealing with, and how should it be challenged?
One thing that we're seeing, like the consolidation of healthcare systems in the United States is really kind of accelerated under the Affordable Care Act. And that's creating these kind of like monster healthcare systems across the United States, where you have, large, often university systems, or in the case of like up in Minnesota, like Mayo Clinic or Cleveland Clinic. These hospital systems are coming in, they buy up community hospitals, they come in with the understanding they're going to consolidate services and create all these efficiencies. But all this stuff doesn't really get around the fact that the main cost for every hospital system in the United States is staffing, and the largest chunk of staffing in the United States is nursing. And so often what you'll end up happening is this kind of strange phenomenon where you may end up with like one of the largest healthcare systems in a state, like in Pennsylvania, University of Pennsylvania, I believe. They basically they declare they have no employees, right? So they on paper, all the employees are all the nurses work for these individual hospitals, but like they're all part of a larger system. And so, where this kind of ties into what we can do as nurses, and in particular as union nurses, is that we really have to build our capacity to organize like large coordinated strike actions that have teeth across multiple hospitals. We saw this happen in Minnesota with one of the largest nurse strikes in the history of the United States. But we also see moments where, with the Alta Bates and the Sutter system had, I believe it was 17 different hospitals across California that had all been consolidated, and they were all bargaining from a common table, which is like a really powerful situation to be in, where every nurse is represented in a contract bargaining campaign. And then we see issues where, for some reason, like all of a sudden nurses from different hospitals are, hit with gag orders. They're not allowed to talk to each other, according to staff. And then you see smaller hospitals in those systems settle out and come up with contracts that we feel like come up short. It doesn't leverage the kind of power that, like, when you take large hospitals like mine, University of Chicago, we were lined up potentially with 3 or 4 small hospitals in our same union, all potentially able to strike at the same time with our last contract campaign. We saw, though, that like the coordination just wasn't there. And we would like to see a situation where our union really does the work of getting nurses from bargaining committees across these hospital systems together, talking to each other to coordinate in a democratic way these sorts of larger strike actions. Because when we find that in California, nurses understand how powerful the strike is, in somewhere like Chicago, University of Chicago struck in 2019. When I was there, it was the first strike of nurses in hospitals in decades. And as soon as we struck, we saw giant pay raises coming to surrounding hospitals like Northwestern, Christ Advocate, Rush, the thing we'd say is like, well, they used to point to us and say like, well, you're overpaid. Or like, well, obviously these nurses are underpaid. Now they're getting all these raises because the people who own the hospitals are so afraid of organized nurses like taking disruptive action at the workplace.
And I covered the strike at Alta Bates and learned that as a result, the different units had been whipsawed against each other, and they ended up with the weaker hospital units giving up their defined pensions, which is a major hit for a union to lose your defined pensions, and that's going to undermine healthcare workers, nurses, and other areas as well.
I just wanted to add to that. I'm a nurse. Like I said, I've been a nurse for almost 20 years. I don't see that these hospitals buying other hospitals is actually improving the healthcare in the community. What I have seen is over extremely long wait times in the emergency departments. I have seen patients being put in hallways because there's not enough beds. I have seen them not paying attention to the severe mental health crises that's happening with pediatrics as well as adults. I have seen not enough equipment for the nurses to do the job that they need to do. And so that's why I think it's so powerful to give the nurses the tool to advocate for all of these things, because these hospitals buying other hospitals so that they're a conglomerate of like 10 or 15 hospitals doesn't seem to be doing the job of what it maybe was supposed to do, which was to create a better healthcare system in the community. What I'm seeing as a nurse at the bedside and what I'm hearing from the patients as they come into the doors is that they're having a really hard time seeing their primary care physician. They can't afford the medication that they're being prescribed, or the pharmacy doesn't have the medication. So I think we really need to focus on doing good healthcare in the hospital instead of buying more and more and more facilities, and you've overstretched your budget, and then you can't provide that great healthcare that we want to provide to the community. And again, that's just going to have nurses come into the profession with this passion and this love to care for the community, and then seeing what it's really like inside the four walls and walking right out. Okay. And that's just going to, make the healthcare crisis even worse.
2 points. Tagging onto what Xenia just said, the Fairview system that I work at are partners with the University of Minnesota, and they have mHealth as the umbrella organization that covers both. Just last year, Fairview decided, without telling anybody, without telling the University of Minnesota, which became very, very angry, they wanted to partner with a different partner, Sanford Health. Sanford Health is known for being, very business, very, corporate-like structure, no union. They have, they cover a lot of the northern and western Minnesota areas and the southern rural areas. And what Xenia just described, exactly what was going to happen if this partnership went through, OBGYN clinics, for example, in rural areas, women would have to drive 50, 60, 80 miles to go to see their OBGYN. And this, can translate into, when time to deliver, it can make a difference between life and death, if it's not, the same town or next town over 10 miles or so. So that's point one, real effect on real people in healthcare. And that's how corporate health, structure is working. The other one is transparency in the employers, how they pay their employees. I had an experience myself of not being compensated correctly. And many other nurses that I worked with had the same problem, but by the end of the day, they just look at their paycheck and just forget that there is a problem with it because their life is going on. And I had helped some of my colleagues who thought, this is what their paycheck should look like. But I told them, no, you are entitled for some bonuses for some things. During COVID, bonuses that were announced by the employer, they were not paid out correctly. And, these people got paid correctly. In my case, I had to fight them, go to the civil rights division at the city of Minneapolis. They had lawyers there. They advocate for workers, and they can reclaim unpaid salaries to workers of all kinds. And it took almost a year to get the right amount of money that I deserved in the first place. It took a whole year. I didn't care about the money at the time, but it was a principle that you promised me this much pay, you should pay me, and I don't have to beg you for it. And that's where unions come in and can be more effective in this area. Because to tell you the truth, at the time, my union said, oh, just fill out this form to complain, and nobody did anything about it. Until they heard from lawyers from the city of Minneapolis, that's when things started moving.
Well, the CNA and the National Nurses Union has said that it's run by the nurses, that the nurses are in charge. What is really going on as far as the change that you see taking place in NNU to make it a more democratic union and a union that responds to the issues that you're discussing here? What's your program to change the union and restructure and confront these issues?
Kind of tied into all these things that we're talking about. This is kind of like the democratization, making our union more transparent, making sure that leaders are accountable, ensuring that nurses have like the autonomy to make decisions within the union without like being kind of like monitored and minded by staff. These things all kind of tie together. As a nurse who worked through COVID, who ended up getting sick with COVID, had long COVID, and then like tried to use the union to get some sort of like compensation from this multi-billion-dollar organization that I work for at University of Chicago, I was all of a sudden confronted with the fact that in my union, there was very like how you interacted with the union if you were not like, I've been active in the union for political things. I've been active in the union because I believe that the union's good. But like when you actually need the union to do the thing that unions are supposed to do, which is defend workers, all of a sudden the union becomes very opaque. It becomes very difficult to understand how to put pressure in on to move the mechanisms of power inside the union. And so a huge part of our goal is to make it so that our union is extremely like, so that anyone who's a rank and file dues paying member can understand how the union works. They understand what their rights are inside the union. So we have a huge educational task in front of us, because most people show up to work, they do their job, they pay their dues, and then they don't have there's no extended effort, unless they make like, you have to make an extraordinary amount of effort to find out how the union actually works. If you ask our union for things like, what are the bylaws? Like, you get like this weird runaround, and like, we had to go to the Office of Labor Management Standards to figure out like basic things like how our union operates that way. That's not our main focus, but it is a very critical focus. And we feel like this is like a step towards, rank and file nurses really taking over independent. We're not picked by directors or picked by staff to run for leadership. We're coming in because we see issues in the union. We've tried to remedy those issues inside the union by like raising them inside of our current union structures, and then basically being told that we're no longer, our opinions or our thoughts, our suggestions, and our own volunteer work is just not welcome to like try and make the union a more responsive democratic space. So this is where we step in and we decide we have to organize. We have to learn. A coworker, a labor and delivery nurse, is like, she's very active in the union. She's like, she tells her coworkers who are upset about something in the union, well, you're angry about the union. Are you angry enough to learn how the union works so you can do something about it? And many people don't quite make that next step. It happened to me because I lost like a good quarter of my income, or like really half my income for the year. And like with kids and a family, like it was just an immense amount of stress. And the fact that it took so much work to figure that out, and still like not getting everything we need out of it. I understood that I had to educate myself and other nurses about what was going on so that we could change the way the union works, so that we could really lead the kind of fights that we need to fight, so that our life as workers is better.
Yeah, I wanted to add to that, to what John just said. I think that for me, in part of this Council of Presidents slate running for National Nurses United officer position, I really want to focus on educating the nurses about what it is to be in an organizing model kind of union, where you're giving them the tools on how to advocate in a way that is going to make them feel fulfilled. It's going to make them have their patients get a better quality of care, and they're going to be able to do so without the fear of risking their job over it. And so we have already started. We're having weekly calls open to anyone to ask us questions about, how do you even vote? How do you get a ballot? How do you find out who we are and what we stand for? What are our principles? And so I think that educating the nurse is really powerful about what it is to be in a union. How is that different than being in a non-union kind of job? And not only that, but then what are the things that you can do to be able to deliver the quality of care, the compassionate care that we all want to give as nurses to our patients. And the only way to do that is through collective power, which means not one voice, but many voices. And I think that when the nurses see that there is this huge disparity between what myself, Jehad, John, and Rosita are doing and the rest of the rank and file movement versus what they have had happen in the past, where things are sort of happening and they don't have any idea of what's going on and they're just sort of going along with the flow, I think they're automatically going to be able to see the difference between what an organizing model of union activism is versus a business model.
And I mean, business unionism dominates the trade union movement in this country. Labor management partnerships, working with the bosses, that pretty much dominates most of the labor movement. Now, there is a struggle going on in the unions about those issues, whether the union should be in collaboration with management. Where is that in the NNU? And also, is there democratic debate and discussion at the conventions of the NNU, where the members can raise things, delegates can raise resolutions on issues, so there can be a healthy debate from the delegates and the membership about what's going on? Are the conventions Zooms so people can watch them? I mean, who pay for the conventions? What's the process of democracy in the union so the members can really participate as union members in their own union?
Oh yeah, absolutely. I mean, that's a huge point, right? Like you just like that's like a loaded question that like we can go down any one of those little rabbit holes and like really come back to the same answer, that there really isn't a democratic process within the union. It really is the kind of the model that is being displayed for us. And I say displayed because I always think like, this is the union. This is your nurses union. Yes, we fight for you. But what's missing from that display is you turn it on the back and there's this little small fine print, but your voice doesn't matter. If you want to raise an issue, there's not really a transparent way to actually access information or to actually be that voice. And the convention is one of those things. And I think, I kind of heard of Shift Change before the convention. And when I went to convention, there was like whispering and murmuring, oh, that's the Shift Change folks, or, be wary of them. Like they're like the boogie monster, right? But then when I started digging really in and I had my own issues, that had came up, you really start to understand that it's the small voices that they try to smother and try to get you not to listen to are exactly the voices that you actually do need to listen to. Because what's happening is that the rank and file actually don't have that voice in our union. It's a top-down model. We're going to tell you what's important. We're going to tell you how we're going to fight it. You're going to fall in line and you're going to fight it the way that we want you to fight it. And that right there is not the model that is necessary for nurses. And if anybody knows a nurse, if outside of whoever's listening to this, nurses do not like to be told what to do. We are very fierce. And that's the reason why we're advocates, right? Because we know what our patients need, the same way we know what our colleagues need. And it may look different from state to state. The nurses in California may not have the same view of what a nurse needs in Texas or Arizona, but the fight is still the same and the voice is still the same. And in order to have a very healthy union, we have to be able to listen to voices that we may not even agree with, but may bring up points that we may need to discuss. And so healthy discussion is actually a way how you grow. If you stifle the voices, then you're not actually really listening to the rank and file. You're not actually listening to your union, and it's actually not really powerful in the way that you think it's powerful. You are actually dictating how that power is displayed. And that is the huge problem. NNU, we're not anti-union. And a lot of people will say, oh, Shift Change is anti-union. No, what we are is pro-nurse. And being pro-nurse means listening to the voice of the nurse. And that the way we take our fights and we instill our fights and we show our fights and we, support each other as colleagues is understanding that each of us have a voice within the union and that we can come to understandings. And, you mentioned the convention. That's one way, when you speak of the resolutions, We actually don't have very much say in how the resolutions are written. We sometimes will get a booklet. Some delegates don't even know what a delegate means. And basically a delegate is you are asked, the way it was you're asked, hey, you want to be a delegate at the convention? You get to go to the convention. It's a great convention. You get to learn stuff. But really the education of what the delegate isn't in that process. And being a delegate means you get to read the resolution, you can make changes to the resolution, and then you can actually have a debate on the floor of whether you feel that resolution resonates with all the nurses. But that information really isn't given to us. And so when you talk about democracy, in order to have democracy, you have to have that voice of the nurse. Hopefully that answered your question, Steve.
Okay. Well, I mean, what I covered, was what happened at all debates. And it surprised me that the staff, from what I heard, were organizing to divide the membership, and which resulted in the nurses at Sutter Hospital, some of the new nurses, losing their defined pensions, which is an important thing in unions. So you have a defined pension. Was that ever a debate and discussion in the union about what happened at Sutter Hospital and what that means to other nurses? Because if a hospital chain can get rid of defined pensions at one hospital or a couple of hospitals, they'll go for it in other units, and it threatens the whole viability of the union to protect the benefits they have.
Talking about pensions and democracy and internal debate around strategy, those sorts of things. I had a pension at University of Chicago Medical Center. I paid into it for 3 years. And then there was, because there wasn't contract language dictating that all of our retirement benefits would be, set, at the negotiating table, the University of Chicago took our defined benefit plan away. And that anytime in meetings through several contract campaigns after that it has been raised that a pension is like a thing that rank and file nurses value and think would be it's part of the way of like making nursing in a particular facility a lifetime goal, right? You want to make it so that every nurse who comes into a facility sees that as a place where they want to be for their entire career, because the longer a nurse is working in a facility, the more skills they kind of accrue, the more knowledge they have about their patients. And when we raise that, a pension is one of the things that could make that, more enticing to younger nurses, we are told by staff, oh, you will never get a pension back. Pensions are gone forever. And at the same time, we know that our union staff pay into the steelworkers pension, and they get to pick, And so the question becomes, where is it that these decisions are being made, that things like long-term benefits that could make being a nurse like a more enticing thing for younger nurses? Never, it certainly isn't being debated inside facility bargaining councils, or it's not being allowed to be raised at literally bargaining committees. And then our bargaining committees are always under gag orders. We're not allowed to open bargaining is a dirty word inside of our union. So these are the sorts of things where if nurses need to have an opportunity to discuss and debate strategy of our union and what our priorities are, instead of those things being decided by people who have never been nurses. And so I guess that's all I got to say about it. It's like that we made multiple proposals that would make the union CNA NNOC aspect of NNU more transparent, more democratic, making sure that elections are announced a year in advance, making sure that everyone's prepared and knows the process. Every one of our proposed amendments to the bylaws were shot down as not in the fiduciary interests of the membership, which is kind of like a broad term for saying that we don't think we're going to say, and it was literally a form letter that they copied and pasted 5 times across different bylaws we proposed. I don't want to get too deep into it because most people, their eyes glaze over this stuff, but any rank and file nurse should be able to bring a proposal to the floor And that is not a right that we have inside of our union.
And another issue along those lines is these so-called NDAs, non-disclosure agreements, which they actually signed in the Teamsters UPS negotiation. It sounds like a corporate, agreement, which basically the management knows what's going on, but you can't tell the members what's going on because of a non-disclosure agreement. The whole idea of a non-disclosure to who? I mean, you're supposed to be representing the members when you negotiate.
Absolutely. I mean, I was just going to mention something that is really vital in order to have a better functioning base for any union, which is an informed rank and file. And from my perspective, from what I've seen, the nursing population, if you will, that I've been working with has changed dramatically recently. We have a lot of new grads. Many people that I used to work with have left or went somewhere else or retired. But the new generation doesn't really know all these issues. All they know is I'm here, work my 8 or 12-hour shift, and then go home. They don't even understand what is a pension and how it works, and is it better than a 401k? Nobody is teaching them about this stuff. And if we start educating them, mobilizing them, giving them, an objective picture what they can do to protect these, things that they gain, the gains that came through the union, they would appreciate it more, and they can be, more involved when there is a challenge or there's a strike, because the younger nurses were saying, I don't know, why should I strike? I just want to work and get paid and pay my student loans, and that's it. They don't get the bigger picture, how nurses, stick together, how they bargain together, and how they protect each other. So education, mobilization is a huge piece here.
And as far as this election, it's a national election. You're running for a national board of the National Nurses, NNU, National Nurses United. Are there debates? Has there been debates of the candidates? Is there a vehicle for democracy, democratic discussion, debate nationally about the direction of the union?
No, there isn't.
You want to schedule one? If you want to organize one, we're ready.
Have you invited the people that you're running against to have a debate? Or, I mean,
one thing that we have done is that we are part of many of us have met through or participated in. There's a healthcare worker network that is organized, through Labor Notes, which is an organization that promotes union democracy. They haven't endorsed us. They haven't given us any coverage, but, this is the space where, these sorts of things, the same sort of processes that have happened in, say, teachers unions, or, things like I've met UAWD through Labor Notes folks. So this is the UAW reform group. This is where we've put ourselves out there. We've brought up, these various concerns, and there's been some debate. It is not a debate that's led by the leadership of these particular, the incumbents in our union. And we find that and I hope that this isn't just like, I inside of nurses unions, our experience inside of our nurses unions is that a lot of these discussions get very personal. They get they happen often private. Nurses, there's a term from nursing academics called lateral violence, where or the idea that nurses eat their own. Which, as a nurse, I'm in the middle of my career. I've been a nurse since I was early 20s. I'm like turning 42 this year. It's the things that I think that we as leaders need to combat, right? Like, we have to build solidarity. We have to create a space with open debate and open discussion. And our union does not end up, using that kind of these opportunities to allow that discussion to happen. And when people raise these concerns, they're often end up being ostracized or treated as though they're hostile to the idea of the union in the first place. And I think we have a big hill to climb in front of us in changing the culture of the union so that every nurse, they has an opportunity to raise their voice if they want to. And in my experience, when people, the worst point where you could be in a union or an organization is where people don't care enough to raise their concerns, right? And so many people have kind of tuned out from what's going on. Our last election in CNA and NNOC was only 6,000 votes were cast, and that was the highest number of nurses voting in a CNA and NNOC election in years because it was actually contested. So 150 plus or minus 1,000 nurses, 6,000 nurses decided that it was worth their time when we made the effort to communicate through normal email communications as part of a campaign. The election committee made sure that you had to opt into election communications, and only 1,500 nurses out of the whole 150,000 nurses in our union decided to be opted in to the sort of communication about what's going on inside the union and the direction that the union is going. So it's not that bad in NYSNA, which is the New York State Nurse Association. Xenia will tell you, she's like, our union started in a very different space, and we are definitely not, this situation for us is different. But at the same time, she's like, but we don't want this to happen to us, in NYSNA. And I can let Xenia talk about it, but our goal is to bring the values that we find in strong pockets in our union, like in the VA. The VA is one of the last parts of CNA and NNOC that still has some semblance of democratic process for their division, their Region 15. And
how is their democratic process different than most of the other units?
Yeah, so we have all these regions, and the union's broken down into regions, and they're not locals like in a normal union. They're based in these regions, and they had, up until very recently, had a set of bylaws whereby decisions were made through votes. They would gather they call them the directors, but they are the equivalent of a chief nurse rep, or in the rest of the union, or a chief steward, and they would bring the directors and vice directors into quarterly meetings. And when they would have issues, they would have an actual discussion, debate, and they would vote and be able to decide how, nominally resources were being distributed inside their division. There's no such organization like that in my region, Region 13. We just have something called a Metro Council, and we've been told that the Chicago Metro Council is one of the more lively Metro Councils. And so, but we are still very much prescribed to, it's very limited participation to just activists, not rank and file. And our decisions and what we make are very much, the staff try to steer it. So, that's kind of the contrast between my experience versus other parts of the union's experience.
And Xenia, you have your hand up?
Yeah, no, I just wanted to add, going back to the question you mentioned before, are we able to debate with the candidates that we're running against? And to be perfectly honest, no. I mean, just straightforward. We weren't aware of who was also running for the position of Council of Presidents, which there are 4, up until we got the ballot. So there was no room for debate whatsoever. And part of this amazing document that folks here have spent the better part of a year creating, the mission, vision, values statement for Shift Change, part of it talks about democracy and how we would like to see that these elections are well advertised, maybe having town halls about them, perhaps having debates between the members. I have to tell you, there was no list of even the delegates that are running for this election in each of the 5 different unions that are under the NNU umbrella. And we started a petition around it because we don't understand how the Council of Presidents is advertised in the NNU magazine, the VPs as well, but the delegates who are supposed to be sort of the ground level that has the closest touch to every single nurse in every single department and brings forth resolutions, they're not even put into the magazine. So you don't know who they are until you get a ballot. So how I'm supposed to be voting on someone that I've never met, never got to see what they stand for, what their ideas are, what their vision is to move the profession forward, to move the union forward, to make it a stronger, healthy, vivacious, exciting thing to participate in, until you get a ballot in your hands. It doesn't make any sense. So we are trying to make that change. Whether we get elected into office or not is irrelevant. The work is going to continue. The message is going to continue. And I think you're going to see more and more people running for these positions as time goes on, especially NYSNA, who I'm a part of. We just joined NNU 2 years ago. This is the first elections that we're having. And I just decided to make TikTok videos on how I found out about it, how I decided to run, and everything else to sort of spread the word about nurses, because there was no information given to us in advance other than seeing it advertised in a magazine back in November.
And I read in Shift Change your program, and one of the issues is you say that the mergers, the way these mergers have taken place of the different units has been top down. They haven't really been democratic. And the whole structure is really hidden from the membership. Is that true?
Xenia, you have the most recent experience with this. Do you want to give a little bit of your perspective on what happened when NYSNA joined NNU?
I mean, there were two times. I am also a NYSNA convention delegate. So back in 2018, there was a resolution brought forward by a convention delegate for NYSNA to join National Nurses United. That was right after we came off of a very heated, very divisive contract negotiations with the big four hospitals in New York. And that resolution to join NNU was struck down. We felt that we needed to regroup as a union, learn from what happened in the negotiations between the four hospitals before we could add another union on top of that. In 2022, NYSNA had multiple town halls where you got to talk to, I guess it was NNU nurses as well as NNU staff about what it meant to join NNU. We were given the affiliate agreement where it said that if we decided that that all of sort of the same things we had in the NYSNA bylaws was going to remain the same. We were not going to be dictated to. This is like a summary and my interpretation of the summary. We weren't going to be dictated to what we can and cannot do in our facilities by joining NNU. We still remain independent. And if we needed, and if we had a vote of the membership to dissolve that relationship, we also could do that. And so I think that the nurses felt like it was well presented, and then it ended up, like I said, eventually getting voted in. Now, hearing all these stories from these other members of MNA and CNA and NOC, we'll see, time will tell. But that was the process that we went through back in 2022. This will be our first elections for officers as NYSNA. This will be, if I get elected as a delegate or part of the council of president, this will be my first convention attending NNU. I don't have any information about it. I guess I'll get it after I get voted into office, but we have a very different process in NYSNA for convention delegates than this. That much I can tell you.
And I mean, one last question. I mean, some of the strength of like the ILWU and other unions, UE, is that the staff are actually workers in the union. And they have in a local 10 in San Francisco, ILWU, they have a term limit, 2 terms, and then they go back to work as a longshore worker. That really makes the membership, even though it's difficult to have elections, a lot of elections, it makes the membership closer to the staff. And if the staff screw them, they have to go back to work with the staff. And it seems like your situation is the staff are really not nurses who have to go back to work as nurses for the contracts that they support in the union. Is that the case?
there are very, very few nurses who are still working as staff for CNA, NNOC, and for NNU. The vast majority of the staff have never worked at a bedside. And like there was a time when many, like there were directors at the director level who were nurses. And there was a time when CNA, NNOC, and and it, like when it affiliated and built NNU, that being a nurse in staff was something that was like a valued thing. We have seen, like especially after Roseanne DeMauro left the director role and she was replaced by Bonnie Castillo, that more and more of the people who are in staff positions either quit or are fired, who are nurses. And we have seen that there is like a serious like disconnect between what staff think about nurses and how they think of nurses and where they understand our power. Again, they think our power is like a moral power that's like, comes from our like how people perceive us, rather than the fact that as a worker in like my personal situations, I'm a worker around perioperative care, and that is a huge choke point and a part of that's where the most money is made for my hospital system. And so you end up seeing things like in outside of California, you see, one-day strikes. You see strikes that are more symbolic than they are like actually disruptive to the healthcare system. And we look at group like ILWU, and we see other more democratic unions, and like those relationships didn't come out of nowhere. That took a long time to build over the whole history of those unions. The history of those unions goes back to like the 20s and 30s. But we do understand that like if we want to rebuild the union into a more democratic thing, that like things like term limits, building training for rank and filers about their union rights and how to get involved with union work, figuring out how to, maybe Xenia has some different perspective on this, because we've also seen when things like when bedside nurses get pulled into staff temporarily and then spit back out, the current practice in our union is to kind of use that as an indoctrination moment instead of as like a, here's how the union works so that you can go back to your bedside job and like actually take that knowledge and help your coworkers. And so we really have to be careful with how we are doing this stuff. And we need to, and we're working on like through the process of this campaign, building that culture of democracy so that we can actually get to that point where we do have like staff are like know that they like whatever contract they negotiate that or whatever campaign that they help organize, they're going to have to come back and face the reality of that contract. Right now, like this is like, I remember talking to the director of bargaining, Corey Lanham, and I was under the impression that at one point he had been a nurse, and I'm like, you were a nurse, so you would understand. He's like, whoa, let me like correct you, John. I've never been a nurse. I'm like, and then all these things just clicked. Whereas like, oh, the guy who's like who's really determining how all of our contract campaigns are being fought from the top down has never been in my position, has never seen what it's like to watch management make a decision that literally kills a patient or leads to a nurse being injured. And that whole, like, that just crystallized as like, oh shit, we have to start doing something. We have to change this. So anyway, I guess that's hopefully that answers your question, okay, Steve, but we're looking to get to there. It's going to be a process.
We have a website. We have on the margins of labor notes, we have a meet and greet. Okay. So the website is shiftchangennu.org. People can go there and read about our platform, different statements and philosophies and plans, etc. So And they can sign up for more information. One of the issues that that seems to be a chronic problem is that not all nurses are getting ballots to vote. So we made it easier for them just by going to the website or scanning a barcode. It fires off an email that goes to the election committee so they can request the ballot, so that they can vote and make their voice heard.
Well, I hope the members know that there's even an election, because I know in many unions, including the SEIU, people are even informed that there is an election, and people who want to run don't even know what is required in order to run.
Right.
That's a real problem. That's a real problem.
Funny you should say that, because we were rounding the other day, and some of the nurses didn't even know what National Nurses United was, let alone receiving a ballot and voting and sending it. Some of them acknowledged that they received a ballot, and they said, we didn't know what it was for. They thought this was like the local M&A election, or it's something from the Department of Labor that was following up on the M&A election back in November, and they were being, I don't want to say harassed, but they were being pursued by the Department of Labor because the election that happened and a new board of directors came along. They are still contesting that. So the Department of Labor is looking into it until today, even 4 or 5 months after the election. I tell you, power corrupts, and people who hold power don't like to let it go very easily. So, and I think that's where it was coming from, even though M&A itself did their investigation and didn't see anything wrong with the election.
I want to thank all of you for joining us, and I hope that more people get involved in the NNU. We need an active labor movement. We need people who are aware of their unions, how they function, how they operate, and how to make their voices heard. So thanks for joining us on our show.
Thanks for having us.